Hi, and welcome to the Healthy Built Environment for Health Professionals training series. We are very excited to be introducing Luke Sales, who's Director of Planning with the Town of Qualicum Beach. Today, Luke will be presenting his presentation titled Towards a Healthy Built Environment. And now I'll pass the mic off to you, Luke.
Thank you very much, Kelsey. I'm happy to be giving this presentation. So I'm presenting today on building a healthy built environment, and specifically healthy food systems. Most of you would be familiar with the Built Environment Toolkit that was prepared by Provincial Health Services Association. So I'll be going over those items a little bit, but also just flagging those areas where I can add something from the perspective of a planner, from the local government perspective. So once again, my focus today is on food systems. In the Healthy Linkages Toolkit, you'll see there's a number of aspects that should be flagged as an important part of creating healthy communities. I'm just focusing on food systems today. So these are the 5 areas that were identified through the process of creating a healthy built environment. Now, when I was asked to give this presentation, it created a really unique opportunity, because it's not often that I get a chance to speak to health professionals. And what's really exciting about this is, in our various expertise, we all know a lot about particular fields, and we might know what those problems are that are created by whatever, food systems, transportation, what have it. We see a part of the problem because that's the area where we're trained. So this slide is just kind of me. I'm groping around. I'm trying to figure out what this problem is and trying to describe it. But the fact is, I'm only seeing a part of the problem. And what we're talking about today is communicating with professionals from another field who might be seeing another part of the problem. And you may be more savvy at this than me. Who knows? But you're also only experiencing, only sensing a part of the problem, a part of the issues that we all need to deal with as professionals. So the good news is that we are together today. The discussion that we're having now is a really important step in the right direction, where we're bringing our own expertise from different fields, and we each have a bit to contribute to the potential solutions around these problems. And together, I think we could describe very well the elephants in the room. I also just like this little comic. So in the Healthy Linkages Toolkit, the first one is enhancing agricultural capacity. So the most obvious thing when it comes to agricultural capacity is what not to do. We've all seen this story. It's been unfolding all over the world for many years now, and that is the conversion of productive agricultural land to non-agricultural uses, whether it's residential subdivisions, industrial, whatever that is. Food can't be grown in these areas as well. So the number one priority would be to retain the ability for soil-based agriculture. Now, I say soil-based because there are ways to grow food in a much more resource-intensive fashion that doesn't involve soil. But for the purposes of this discussion today, our first priority should just be to retain agricultural capacity by not ruining the land in the first place. So, having said that, the transition from highly productive agricultural land to urban or industrial wastelands isn't a one-way path. There is an opportunity to reintroduce agriculture into urban areas, and we've seen this implemented very successfully around the world. Good examples would be Havana, Cuba, where you see a very large proportion of foods being produced within the city boundaries, which is pretty amazing. It's very, very intensive use of the land. So you see these little pockets of what was undeveloped city infrastructure being converted into productive food land. So you may despair over the loss of farmland, but it's not a one-way path. In the end, the productivity is probably not quite as good, but if you throw a lot of resources and human effort at it, it can be productive. And then on the extreme scale of things, we can grow food pretty much everywhere. I would understand Matt Damon recently grew food on Mars, so if he can do it, obviously we can. And you see a lot of this happening in large greenhouses, greenhouses that are 40 acres, 45 acres, all producing very high value crops like tomatoes and whatnot. But this type of vertical farming can be used to grow pretty much anything in a very small footprint. Now, it takes a lot of energy to do that. It's much more resource intensive. So this is a scale where the easiest thing is soil-based, and then you gradually transition through urban farming and whatnot, and then here's the moon farming, the hydroponics, and really resource-intensive greenhouse farming. So the second part of creating a healthy food system is increasing access to healthy foods in all neighborhoods. You probably read some of the stories and research around the concept of food deserts and places where people simply don't have access to healthy food choices. And obviously this is a big issue, has major implications for people's health, diet, food preferences, obesity. Now there are a lot of tools at our disposal to increase food options, and this is a screenshot from Qualicum Beach where we have a very successful farmers market that brings thousands of people into our downtown every week, and they have an opportunity to get together with the farmers and buy directly from them, buy direct from the farmers, so that creates a more dependable revenue source for the farmers, and of course it provides an extra opportunity to buy healthy, fresh, local food. And it's also an amazing opportunity for communities to come together and really celebrate the value of food. Increasing access to healthy foods is also important in the context of our schools and institutions. We have a lot of power and a lot of combined weight going into our purchasing. So if more thought is given to the way that we procure food in hospitals and universities and schools where they provide it, that can be a huge engine to shifting preferences towards healthy food. So I don't know where this picture is taken, but it sure looks a lot better than the food that I ate in high school and college. And of course the last thing related to increasing access to healthy foods is creating awareness about healthy foods. People will do a better job of seeking it out if they understand the implications of the healthy food choices that they have in front of them. So they may just ride this vegetable bike straight to a grocery store where they can find the veggies. If they haven't nurtured that desire for healthy food, well, they're not going to go out and seek it out. So we do need to bring healthy food choices to them, but we also need to create the public awareness and education that brings them to the healthy food choices. And thirdly, community scale food infrastructure and services. So this is things like school gardens. This is a shot from Qualicum Beach where there is an elementary school site that wanted to get into gardening. In this case, they're planting flowers, but they created a whole field full of letters that have gardens planted in them. So they had students involved with it. The original planting was done by community volunteers that wanted to get involved, and it really turned into a really beautiful site for the students, and also a good place for community members to get together. So this was called the Alphabet Garden, and all the raised beds are in the shape of the alphabet. So maybe they learned the alphabet while they were weeding. I don't know, but I think the people in this photo probably already knew their alphabet. Okay, and once again, community scale food infrastructure is not just about the bricks and mortar sort of institutional things, but it's also just about having fun. This is a shot from what we call Fire and Ice, where it's like a big chili festival, and people get together and celebrate food. That's a part of creating an awareness of healthy food and creating a desire to seek out high quality food. So we get together as a community, thousands of people tasting all sorts of options, and who knows, maybe it inspires them to put a little bit more effort and maybe money into the healthy food choices that they do have. Now, these parts of the healthy built environment are really important, and we absolutely need to focus on healthy food. It's really important, but I also just want to flag some of the challenges from the perspective of local government. When we start talking about one particular area, so call it food systems, climate change, energy, whatever it is, that area obviously is the top priority and should be given precedence against overall everything else. But the fact is that when you're in a decision-making role, you don't have the luxury of forgetting everything else on the table. So decision makers are always wrestling with competing priorities. So I don't intend to go over all the items on this list, but the fact is that these are on the minds of all of our decision makers. And if we want to advance any one of these priorities, food systems, transportation, we need to connect as many of these dots as possible. So you can make progress on a food system initiative, but if you can combine a food system initiative with economics and combine that with health and income disparity, suddenly you start to put together a very compelling package, a compelling argument for healthy food and all these other things together. So we're looking for those linkages. We're looking for ways to address multiple priorities with single items. So you're leveraging resources and you're creating multiple benefits. And then the last point here is the short-term versus long-term. We always have to remember that something can be absolutely the right idea in the long term, and it's obvious from the perspective of long-term planning or healthy food systems, but we also have to rein it back and explain it in the context of shorter-term decision making. Because we do cycle through these governance systems more often than we would if the timelines in our planning were the kind of fundamental reality that we work by. So we always have to keep our eye on the long term, but then explain things in terms of short-term priorities. Once again, we talked about the elephant in the room at the beginning of the presentation. So the idea is that we all have an idea of what the elephant is, or at least a part of it, and it's through discussions like this where I bring my experience as a municipal planner and as someone working in a local government. You bring your experience as a health professional, and the more we work together, we start to put together these dots. We start to connect the dots and try to better understand the problem. Once we understand the problem, we can work together to help find solutions. So this is a great step in the right direction, and I'm very happy to be a part of it. If there are any questions about my presentation, here's my contact information. You can email me or call me at your convenience, and I'd be happy to talk about this or any other items you have on your mind. Thank you and have a great day.